Now joining us we do our injury report every Friday, brought to us by the great doctors at Rothman Orthopaedics. Dr. Bradford Schofield Tucker is with us today. Happy Thanksgiving, Dr. Tucker.
Thank you. Thank you. Thanks for having me on the show. Happy Thanksgiving.
What'd you do yesterday? How'd you celebrate?
Just spent it with family.
No, did you watch a little football?
Great. Oh, all day. All day. Oh, the outcomes weren't so great being a Philly fan. All the teams I wanted to lose all won.
Now, if you were coaching the Bears, you would have at least gotten a field goal and we would have been in overtime.
It was bad clock management. Real bad clock management at the end of that.
I know. We're all dying. All Philadelphia, Doc. We're sitting there going, come on, man. Come on, Bears. Because if the Eagles get home field, guess what? They can beat the Lions at the Link.
No doubt.
No doubt, Doc. All right. Today we focus on Brandon Graham's injury. And as always, we have our incredible doctors from Rothman Orthopaedics. They are not their doctors. We just talk about the injury and what the injury is about. So tell us what leads to a biceps tear.
So he actually injured his triceps. So triceps is on the back of the arm.
Yeah.
Biceps is on the front of the arm.
Yeah, I do my tris and bis, so I misspoke.
So the biceps,
I do my donkey kicks.
The biceps pulls and the triceps pushes. So you can imagine, I mean, both injuries are rare.
Yeah.
It's more rare to tear the triceps.
That's what I was going to ask you, because I've heard torn biceps are not common, but I hear about them way more than the torn tri.
Yeah, the biceps is way more common than the triceps. The triceps incidence is very low, but it is higher in the NFL because you have these big bodies pushing each other, and it's a lot of pushing. And, it's more common in athletes over the age of 30. So BG, he's 36. So all that micro trauma, the triceps, like I was before the show, I was looking at his interview after the game, and it seems like he was having a little bit of pain in the triceps prior, which is tough, which probably indicated that he had a little tendonitis in the insertion of the triceps right by the elbow. And you could even see he goes like this, and you could see there was swelling here, and it almost looked like there was a little tiny defect. So it's not a good sign. He probably ruptured it completely.
Wow. Oh man. So what's the recovery like for that? Like how do you repair that?
Yeah, it has to be surgery. It doesn't heal itself. So it's done open. It's an open surgery where you make an incision on the back of the elbow and you have to reattach the tendon to the bone. Wow. So there's two ways to do it. We have these very strong sutures that are almost as strong as like a wire. And we put like we call it like a running locking whip stitch to grab. It's almost like you crochet this suture in the tendon to get a grip of it. And then you reattach the bone through drill holes in the bone or through something called an anchor, which is like a little screw that screws into the anchor, into the bone.
Damn, Doc's incredible at explaining this.
Yeah, he is.
You're great at this. Oh man, like the whole procedure, what you saw, that's fascinating. Listen, at 36, what are the odds? Like, can he come back? Is this something that age you can do?
He can, but I mean, BG has played for 15 years so far. I mean, the defensive end is one of those positions where I think the average defensive end only plays a few years, maybe 3 to 5 years. So he's already at the end. I mean, you saw how the Eagles were using him. They were like subbing him in and out. But if you look at the average return of an injury like this into sports, it's about 5 or 6 months. So he does have a year to recover. He could potentially come back, but then again, next year he'll be 37, which is tough. It's tough. But I mean, he look at the way he was playing this year. He's was in great shape. He was playing amazing. I mean, if anyone could come back, it could be him.
Doc, I mean, how about the two-hand slap, right, on the way to the sack? My God, it's incredible. Speaking of the slap and the tricep, the way he did it, damn.
Yeah, it was pretty amazing. I mean, he said in the interview, like I tried to look for some injury video. I couldn't see in it, but he was saying he was basically just one of the running backs was doing a pass block on him, and he just chipped him. He just like BG probably just pushed him real hard, and it's when you're if you're contracting your triceps and pushing at the same time, it's that high force that just caused the tendon to rupture. Because he obviously had some micro trauma just playing football for 15 years, being 36 years old.
It's so fascinating because the tendon, like I ruptured my Achilles tendon. So it's the same thing. Any kind of blunt force, if you have trauma, and then the tendon just pops.
Yeah, I mean, BG came back from an Achilles. He ruptured his Achilles back in 21.
Yeah.
And got back.
Yeah.
Yeah.
No, you're right.
When did he tear his Achilles? 2021, I think it was.
Yeah. Hey, it's unbelievable. It really is. That dude, he's like Mr. Eagle. It's amazing, right?
His presence in the locker room is huge too.
Yeah. You're a sports guy, man. Did you?
Yes.
Yeah,
well, I was born in Philly and I was raised in Ocean City, so I've been a Philadelphia fan my whole life.
Yo, well, you got the accent. He's a true Philadelphia accent. I love it.
Well, my mom is a South Philly Italian.
Did she make pasta for Thanksgiving? You always had that little pasta.
Unfortunately, she's not around anymore. But she would make pasta. Like we would always have a pot of gravy on the stove. Growing up.
That's what we did too.
Yeah.
Mine is the same thing. They were the greatest. My mom passed as well. They were the best. Doc, you're fantastic, man. You really are. God bless you.
Well, thank you for having me on.
What a pleasure. Thank you. Listen, have a great weekend, you and your family, okay?
Thank you. You too. Thanks for having me again.
What a great guy. Dr. Tucker, he's fantastic. It's our Friday injury report. All the doctors, dude, are they not great?